Hey, everybody. Welcome to Perpetual Motion, a podcast focused on self care, economic independence, and positive relationships. I'm your host, Dr. Mo Anderson. Each episode, I interview thought leaders from all over the world who share tips and tools that add immediate value to your personal growth. My guest today is no exception. And she is unique in that she's a professional colleague. Believe it or not, in 10 years, I have not interviewed another dentist. I am a dentist, I should say that. And I haven't interviewed another dentist on my podcast in 10 years. But Dr. Stephanie Stoddart is an extraordinary beginning. And I am very excited she's here. We're going to talk about oral health care, access to care, and how changes in our industry are impacting providers and patients. If you're not a provider, I sure hope you're a dental patient. It's going to be a fascinating conversation, informative, and so stay on board, lock in, and if you haven't already subscribed to my channel or my podcast, click that subscribe button now. Welcome, Dr. Stoddart.
Hi, thank you so much for having me, Dr. Mo. This is such an incredible honor, and I can't believe I'm the first dentist in 10 years. What an episode!
I know, right? I had to think about it. I have been on other dentist programs. I've interviewed some physicians, but not a dentist. I mean, I really went back and looked at the history, and I was like 10 years, over 100 episodes, and I have not interviewed a dentist. So, ah, it
Yes,
wasn't intentional. It just happened.
we're in for a treat.
Indeed, we are. Indeed, we are. Speaking of treats, you are originally from one of my favorite places, Jamaica. What brought you to the United States?
Oh my goodness, this is such a powerful question. So, when I think back on how I got here, I just have to thank my dad for seeing such potential in me. Let's just put it that way. It just put so much potential. So in high school, I did the traditional route. I was good in math, good in
Mhm.
chemistry, good in biology, and immediately thought I wanted to be a doctor. And that was the path I was originally on. But he's just like, I think America will be great for you because there's so many other things or professions you could become if you just go out there and see what's possible. So
Wow.
I got here. He put me in a college preparatory program. The
Mhm.
program was by Dr. Minot. He was originally schooled here as well, and he has this incredible container at home in which he raises up young persons like myself to come here to the U.S. to take um, advantage of the opportunities that are here
How
because there's so
interesting.
little back home. Yeah,
Wow.
Dr. Dennis Minot. That's his
Okay.
name, Dr. Dennis Minot. So he
Mhm.
has transplants like me all over the country, and we're blazing trails here because us Jamaicans, we love to blaze trails and just take advantage and give back to the community. So that's been a really big part of my focus here. I've been here over 20 years, and it's just such an honor to be Jamaican.
Well, that is pretty awesome. You've had two is Dr. Minard and your dad. Sounds like you had two amazing males in your life who believed in you, and I'm sure mom was great too. But specifically, where in Jamaica are you from?
So I'm originally from St. Catherine, so that's a county or a town 20 minutes away from Kingston. So if you haven't been there, I usually say Kingston because everybody knows Kingston or
Right.
Montego Bay. Montego Bay is the happening spot, and Kingston is just for us locals, 20 minutes away from my hometown in St. Catherine.
Okay.
And we have really good beaches there, Hellshire Beach. If you want fish on the beach, a
Mhm.
horse ride, any of those things, that's a place for you to go.
Nice, nice. I'm more of a Negril person. I like the
Yeah.
cliffs and the quiet, but yes, Montego Bay is definitely happening. That's where we would go to party on my visits. But I digress. As you know, 20 years you've been here. I've been a dentist 34 years, been in the born and raised in the United States. But less than 4% of dentists are in the United States are African American. And I would imagine worldwide that number even goes down a bit if you exclude Africa and some other countries. When and why I was in the ninth grade. I was 14 when I decided to become a dentist. When and why did you decide to become a dentist? When and why?
I started a little earlier than you. I started at 4. So my mom asked me at 4 years old what I wanted to be, and I was like, "I
Mhm.
wanted to be a doctor, a teacher, a dancer." And funny enough, dentistry includes all those things, right? We
Yes, it
dance
does.
around very tight spaces. We educate our patients on the importance of taking care of their smiles.
Mhm,
And I wanted to be a doctor, and we are an oral health professional, oral health physician, as I like to call it.
mhm,
So that path of mine has been a little bit circuitous because I came here as an international student, and the challenges of finances were a huge concern for me. So I went to school at BU, pursued an engineering degree
mhm.
because that was free. The government pays for you to get
Okay.
PhDs for
What is
free.
BU?
Boston University.
Okay, because I went to
Yeah.
Baylor
Oh.
University, and we call it BU as well, so I was like, "You went to Baylor?
You
What?
took- um,
We have something else in common." Okay.
no, to Boston University. And
Okay.
a friend of mine, she was studying for her DATs. And for you to get into medical school, it's the MCAT.
Mhm.
For dental school, it's the DATs. And I didn't even know about it. And she said, I'm going to be a dentist. And I'm like, oh my gosh, I wanted to be a dentist so long ago, and I didn't know the path to go that way. And she's
Mhm.
like, here you go. This is it. This, know the DATs, get into your schools, and you can make the difference. So for me,
Wait,
when
wait, wait. Hold up. You making it sound like it's just so easy to go to dental school. I'm gonna have to, as somebody who knows better, yeah, that DAT test is hard as hell. And I majored in biology. I'm sure you majored in some science or whatever. So I don't just want to, have any shade on our fellow dentists. It's not just take the test and you get in. So okay, continue.
no, I
That
know,
would
I
be for
know.
you, but for the rest of us, it's hella work. So,
Yes, it is a pretty significant exam. I may have an advantage because I just love exams. It's
mhm,
my thing. It is my thing. But what I thought was really, really neat was, I had this passion in my heart for since I was 4 years old. I was at this junction where I was going to either go into dental school
mhm,
or medical school. And I chose dentistry because in my country, there were less than the statistics, I don't remember the statistics now, but it was literally like one in every 100,000 people had a dentist. So I figured if I came to the US and became a dentist in, you know, 4 or 8 years, I could go back to my country and provide dental care to them. Right. So that was like my thing to be able to give back to my country as well, too. So that's what happened. And what turned out was when I made a decision to to get into dental school,
mhm.
I got into all my dental schools. I literally got into all my dental schools. Thank God. I
Wonderful.
got into all my dental schools. And I chose University of Connecticut School of Dental Medicine
Mhm,
because of their emphasis on the link between medicine and dentistry. So we studied together with the medical students for two
mhm,
years. So for 2 years, I was an MD. So I learned about head to toe, everything in between. And in afternoons during the program, we learned about teeth and the oral health physiology. But what I really loved about that program is Dr. Marja Hurley. She's Jamaican. She formed this program called Healthcare's Opportunities Program and was
mhm.
founded by the Robert Wood Johnson Foundation, right?
Right.
And his mission is to increase access to care within all of our communities. And it so happened that given my academic accomplishments, I was able to secure a scholarship through that school and got a full ride to UConn. So that's how I ended up at UConn, University of Connecticut School of Dental Medicine. And I'm forever grateful for that and paying it forward to our communities.
That's
Yes.
extraordinary. That is extraordinary. At the University of Minnesota, we also studied with the, medical students the
Yeah.
first 2 years, our science courses as well as gross anatomy. When I tell people I had to take gross anatomy, they're like, "Wait, what?" And, you have to remind people one of the challenges we face now, in fact, with, not having, dental care coverage, as you know, for, uh adults like we
Mhm.
should unless there's a disability or pregnancy, is that people in their mind, including our politicians, separate somehow. They think you can have disease in your mouth that doesn't affect your entire body. But as you know, we actually diagnose a lot of conditions. I can't remember how many patients I referred when I saw, various signs of systemic diseases in the oral cavity. So I really, really am glad that you made that point of how there's really no separation, and even the studies need to be integrated, because even though we're concentrating on this, we are treating the body, we're treating diseases of the body, which is why everyone needs access to care, which is
Yes.
something we're going to talk about. But first, I want to know, daily, you're in clinical practice. What type of practice are you in, and where are you, the patient population that you're serving now? I know you got a big heart, so I'm wondering who these lucky patients are who have you as their provider.
So my providers are my patients and providers are near and dear to my heart as well, and I'll
I'm
get back
sure.
to my providers as well too. I typically serve patients within underserved communities, so people who have been forgotten
Hmm.
within either the state system. So I work for a big DSO dental service organization, and our focus is Medicaid patients or patients who have state insurance. So I see
Hmm.
kids between 1 and adults up to 99. So there's full coverage for children who are between 0 to 21 years of age. And then after 21, their healthcare changes. So things like scaling and replaning or deep cleaning, if they needed that, because they had periodontal disease, it wouldn't be covered at 100% or not even
Right.
covered at all, depending on the state that you're in. So in and really jumping into my mission, which is to ensure that everyone gets treated fairly. That's
Hmm.
where I find myself all the time, just always advocating for patients, just always doing the right thing for them, and always supporting providers to be at their healthiest so that their patients can benefit as well too. So something that comes up in mind to me too is like, when I look at the percentage of dentists who are in my population, we have a high turnover rate, and it really concerns me because we hardly have enough people going into the field. So for
Right.
them to leave, and I'm like, wow, it's not fun, because we have patients who have to wait much longer to get care, or even not show up because they've had such a great relationship with other providers. They don't
Hmm.
really trust people anymore, so they don't even come in. So that's a big part of my mission too, just ensuring that providers are at their healthiest so that we can serve our patients at our highest. So
Right.
yeah,
I had
yeah.
a conversation with a physician recently. Oh, I'm terrible with names. I can picture her, but we talked about physician burnout. I'll
Yep.
drop a link. It was a recent episode, but it's just been a really busy day. I'm having a brain fart. But can we
It's
say
okay.
fart? Yeah, it's my podcast. I can
Yeah,
say fart if I
you
want to.
can.
Sure. My grandkids will love that. However, you mentioned the high turnover, and obviously I'm aware of it, but would you elaborate a little bit on that, on some of the challenges that uh, are causing the high turnover rate?
So I think it's manyfold actually. So one, Medicaid reimbursement rates are so low. So
Mhm.
in the field that we're in a corporation, you get paid based on what you do. So
Right.
that's just what it is. So the more you do, the more you get paid. As sucky as that is, that's what it is, right? So
Mhm.
you're treating the patients with the highest level of care, yes, but in order to facilitate that, sometimes they're doing numerous quadrants. So if you divide your mouth in four areas,
Mhm.
quadrant is just four. Um, so you'll do as much as you possibly can. So just patients within that population sometimes don't come back to their appointments, or they don't
Right.
show up. So to
Right.
counteract the no show rates, we double book. or triple book,
Mhm.
depending, right? So
Right.
when they all show up, you are like, holy smokes, this is a very fast day. And when
You're
they don't
running
all
really
show
behind.
when
Right.
they're running behind. So it's just this cycle that keeps going and going. So I figured if you don't have the right mindset, the right frame of mind to go in,
Mhm.
you can burn yourself out because you're just going and going and going with no end. I mean, and you're doing
Mhm.
something good because you're helping people, right?
Right, right.
But sometimes we just don't know how to regulate ourselves, the stress levels. It's just stressful, but we're doing amazing. We're doing
It is,
amazing.
it is.
Yeah.
I worked at an FQHC. I was a director at an FQHC in Fort Worth, and I just wanna add to that for people who are listening. And don't be cavalier about your appointments. The reason that they have to double and triple book is because there's this high no-show rate, so people don't show up, they're late. It may be because of transportation, it may be just not seeing the importance of it. I was in private practice and, for many years, and on Fridays in particular, or holiday, people wouldn't show up because they were just sleeping in. You call in and be like, "Oh, yeah, I'm not gonna make it." So that chair time is valuable, folks, so if you don't want them double, triple, quadruple booking, you need to, value their time, and they can set aside time just for you. I'm just doing a public service message for my colleagues still in clinical practice right now. Keep your appointments, please.
Yeah.
And yeah, and that
Sure.
and that does contribute to a lot of stress. You got the hygienist and the pharmacist on the phone and
Yeah.
patients glaring at you when you get to them, even though, you're doing the best you can. It is very,
It's
very stressful physically and mentally because, just the position and the stress on your wrist and so forth. There's a lot to it. So be kind to your dentist like Dr. Stoddart.
That's please be.
Be kind
Um,
and just say something nice, you know?
yeah. And then, dental patients, sometimes they have a fear of coming to us as well too. So
Absolutely.
in addition to the high stress environment, plus that fear that's being projected onto us as well too,
Mhm,
it's helpful for us to know how to regulate stresses. So some of the things that I do for myself, I just take a breath,
mhm.
take a breath and smile. And if I've had a couple patients who've been waiting, just explain and just be human.
Right.
Don't. It's not a number. It's not a race. We're here to serve. It's just the system that we're in because of the low reimbursement rates. I mean, it would be great
Mhm.
if we had different reimbursement rates, but that's not up to us.
Right.
Well, we
Well,
can always
in a manner,
advocate
it
for that.
is because we elect the people who, you know, determine those rates, but we have to lobby for it, and we have to make
Yep.
sure we know the position of people that we're voting for, appointing and electing. We do have a role there, but sometimes we don't know our own power, and so the lobbyists and the, people who can put money in their pockets or get in their ears, but it's an ongoing, I'm on the other side now in benefits administration, so
Mm.
it's certainly something that we wanna see change because you're right, we're losing good providers, and I'm so happy to hear from you to know that, you can keep doing it and your heart be there, and then you're helping other providers. I know they appreciate that. How do you find I'm getting off of our list here a little
It's
bit,
okay.
but, um, how do you find the providers who need this type of assistance? Do you just recognize it, or is that a separate, profession that you have, coaching?
Yeah, so and that kind of led me to my coaching career as well too. So I burnt out. I burnt out a couple years ago and
Mhm.
didn't know what it was. I'm a high achiever. I work hard, I play hard, I do everything hard. I love hard, everything hard,
Yeah.
just go, go, go all the way. And one of my children, my second son, he just said to me one day, he's like, "Mom, you're always late." I'm like,
Wow.
"Yeah, huh." So that went like, whoa, because
Ouch. Ouch. Just
right,
pierce me in my heart, why don't you? Yes, I've been that girl.
oh my gosh, like, I had my kids to be able to enjoy them, right? So when I got home and I'm shoveling food in my mouth and he's just like, "Yeah, you're late again." And my little that that one is just a little like, yeah, he will get you
Mhm.
right to the core. And
Yeah.
it had me like stopping and just thinking where my priorities were. And I mean, I'm doing great things out there, and
Mhm.
serving the communities, but just ensuring that I was serving my own family in that way emotionally. So I couldn't have been the only one, right? I'm not the only one.
Oh,
So
heavens no.
I
It happened to
I'm
me,
the
and my
I'm not special.
it happens a lot, and
Yeah,
I'm glad mental health is being emphasized more. I'm glad people are understanding that, Batman had help,
yeah,
Lone Ranger had help, know,
yeah,
all of these superheroes have help, but then you have Wonder Woman out there all by herself with some bracelets, and that's that's what we're trying to do is fight the whole world in a swimming suit with high heels and bracelets, and it's just not a good model.
yeah,
But we don't learn that in dental school. You really almost have to crash and burn to learn it, and that's unfortunate. But yeah, one of my kids kinda jacked me up like that with, and I thought, I'm just trying to do a good thing. I'm trying to help my team. I'm trying to lead in the community.
yeah,
I'm trying to be a good mom. I'm running from practice, running from my practice, showing up at your practice in my scrubs, and, at some point, it's like, "Okay, something has to go, and my
yep,
family is not gonna be it."
yeah, exactly. So, I recognize the signs. For me, I was getting numb, like,
Wow.
numb. Like, literally numb. I mean, normally, I'm a pretty, like, outgoing, gregarious
Mhm,
person and just lively, and, for my patients, that's how I was. When I came home, I was literally
mhm,
numb. So that was not cool. My kids
right.
felt that effect. My husband felt that effect too. So that's when a coach found me. She was in my family. I had no idea about coaching as a modality to
Mhm, mhm.
help to help support me with my mindset. And when she found me, the stars always align when you need them to. Actually,
Yes,
always. You
they
just got to
do.
pay attention
Yes,
to the
they do.
signs. And when I found her or she found me, it was perfect. So I leaned into that, shed all the drama, the crap, whatever that needed to go. And I figured this is a way I can pay it forward because when I go back to work, I can just see the signs.
Mhm.
We sometimes don't ask for help, and I just wanted to normalize that it's okay to ask for support. Like you said, we're
Yes.
not Wonder Woman. I mean, yeah,
Mhm,
we have done incredible things as women, but incredible women are also supported as well too. So who do we get to
mhm.
be to ask for support, right? We get to be
Right.
courageous. We get to be vulnerable. We get to be open. We get to be authentic. So
Preach.
drop the mask, drop the ball, drop everything, get support, and it has made the difference. I mean, I come back to work and it's like night and day. So the same things could be taking place, patients coming in, patients being
Mhm.
mad, we're running late, we're not getting lunch in time, and it's just different because my outlook is different. I'm like, who do I get to be to serve these patients at my highest level, right?
Mhm.
And make sure they can leave here with quality work, with a smile on their face, and know that they mattered, right?
Right.
So that's the power that we have as healthcare providers. And I want to keep that going forward. I don't want someone's like, anxiety, burnout, whatever it is to
Mhm.
overshadow
Mhm.
that because we're given such a privilege. It's a privilege to be a doctor. It's a privilege to serve.
Indeed,
And
it is.
I I love that we can tap into that. So that's just a part of my mission as well too, just to support them and to know that I was one of them. I made it over to the other side. And actually, if you don't have to go the path I did in terms of burning out, let's just get you healthy and in the right mindset in the first place. So prevention is always
Right.
better than a cure.
Right,
Yeah.
and we keep the care in healthcare because that is missing in so many
Yep.
instances. It really, really is because we have just run out of capacity,
Hmm.
from, having so many demands and not being equipped to juggle them, to deal with them, and to set up boundaries, which is really, really critical of, things are going this far and no further for my own protection,
Yep.
and you you are doing a really great service to our profession by helping our colleagues who are dealing with this because it is a very, very real thing. I see it all the time in the groups that I'm in on, Facebook and different social media, those private groups where people can really talk about what's going on in their practice. And it's like, oh my goodness, why is this not better? I've been out of clinical practice for a minute and why is this still happening? But
Yeah.
we can get there, and we are getting there. Information is power.
Information is power. And then I just wanted to add one thing too, like
Yeah.
even with the COVID, with the pandemic, I think that's what it shed a light on as well too, just that their mental health, there's,
Mhm,
I
mhm.
guess there used to be a stigma with that.
Oh,
And it's
still is for in a lot of places, unfortunately.
Yeah, it is, but I think more people are being brave to talk about it,
Mhm.
and it can look like me, it can look like you, and that was the point of me talking about it because it's not just a certain population that it affects. It can affect someone like me, someone like you,
Absolutely.
right? So just to put a face to it,
Mhm.
it's helpful. So we can lend a support and
Okay.
normalize it.
Yes.
So yeah,
Yes, I love that. You, well, I wanna go back to the access to care. We
yes.
know access to dental care is not equal for all areas. They talk about food deserts, there are also dental deserts. You have provided care for thousands of children in underserved communities. Tell me more about your mission to increase health equity and how other providers might, join in to make it more equitable and provide care to more communities.
This mission started because I in Jamaica I didn't have dental care growing up, and a lot of people look like me. I'm female, black, and coming to the U.S. was a shock because when I came here, I thought the streets were going to be paved with gold, right? Because that's how they make it seem in Jamaica. You come
Right,
here and it's like, wow, it's
right.
and you notice that there's like a dichotomy, and certain people have and certain people don't, and all the things that go behind that. But
Mhm,
at the core of who I am, it's always been service and to see those who haven't been seen or those who have been forgotten. So
mhm,
when I got my first dental job, that's where I ended up. I ended up in a dental service organization that primarily focused on that um, subset of the population, and
mhm.
I've always just loved being there.
Okay.
I tried private practice in a nicer area, all the things, and I just wasn't fulfilled. I mean, whoop-de-doo, you went to Milan. Great. But when I go back to my communities, I can talk to the kids. That's what it is. It's the
Mhm,
kids and knowing that, their parents didn't have the opportunity, but now they're coming to the office. So when they come to my office, they know they're going to get like education. They're going to get math. I'm quizzing them on everything. I had this one patient. She had
mhm.
nails for days. Like, what do you want to be when you grow up? She's like, I want to be a surgeon. I was like, not with those nails, but
Right.
are you willing to cut your nails? And she's like, yes, I want to do it. So just to be able to come in and see someone like me who, came from a different country and
Mhm,
despite all the odds, rose to the top, became a doctor, and is giving back in that way, it warms my heart. And my patients can feel the difference as well, too. So my company that I work for, they've been doing this for 20 years. So they've been a pivotal um, stand. I've taken a strong
mhm.
stand for underserved communities, and I've always partnered with them. And more companies are doing that, so I
Yes.
love that. And they also recognize one of their values is diversity because they recognize that having different philosophies, different thought processes,
Yes.
different cultures just adds to the diversity of the population that we're seeing right now,
Mhm.
right? So more
Right.
women graduating, more minorities that are graduating as well too. It's only going to add, patients trust people who look like them,
Mhm.
and it's the truth, right? So
Yeah,
if we have
there's
more,
research that's proven. I mean, that's
yeah,
in fact, I just gave a speech on health equity, and there are numerous studies, polls, surveys that prove what you just said is very
yeah,
true.
yeah. So that, patients want providers who look like them. I mean, that whole bias will immediately dissolve because you look the same. So you're not going to be, for fear of like being treated differently, that you just know that the person, they can see you the way you want to be seen and to provide the care that you need. So I love that diversity is a big piece of my company's values, and that's why I associate with them. And I just keep encouraging different schools. So my school, HCOP, that was a big mission of theirs too.
Mhm.
So the fact that I got a scholarship from there, it wasn't just, oh great, you got a scholarship. No, what are you going to do with that? You got the biggest gift. You got a free ride to dental school. Like, how are you going to pay it forward? It
Yes.
means going back into the communities. I mean, it means mentoring kids that are all the way from kindergarten all the way up so they can know that there are other opportunities that are available to them. They may not have that role model at home, but when they go out and they see it either within the schools or the communities or the health centers
Mhm.
that they go to, they're like, oh, wow, I never thought about that. But if she can do it, I can do it too. So
Yes.
just being able to sew back into the population in that way, that has been like huge. I mean, huge.
Yeah.
My kids, so we have a biracial family, and my first son, he has some color, perfect. He has some color, and he notices that he's black, and he's just like, yeah, it doesn't matter. Like, it doesn't matter. And we took him to a school that had more diversity, and he just saw like what
Mhm.
that added to him, and he wants that. And we're like, yes, great. Like it makes a
Mhm.
difference. I mean, they notice. They notice.
It really does. It leads to better outcomes on every level, and it doesn't just have to be racial,
Yeah.
diversity of gender, diversity of opinion,
Yep.
diversity of age. There's so many ways we can do diverse. I certainly believe, in having, different ethnicities and different genders, but there are a lot of ways, and now that I'm, you know, 60 years old, I'm all for diversity of age as well. There's something to be
Yeah.
said for experience and a calming presence sometimes,
Yes.
when people are bouncing off the wall and just be like, "Baby, it's all right, trust me. It is gonna be all right." It really, really is. There just so many ways I can go off here. I'm trying to stay on track, but this is just a
It's
a a
okay.
really good conversation, and I'm
Yeah.
glad that you're sharing your experience as an immigrant, and I'm glad that you stayed here. You said at one point you were planning to go back home, but, as you learned, not only are our streets not paved with gold, but there are a lot of people here who had the very same experience of not having access to care or having any dental treatment as you have back home. We'd like to think everybody here is, you know, in their mansions on streets of gold, but far, far from it. There are a lot of underserved people in need.
And need for sure. It's funny you said that because I didn't have dental care growing up.
Mhm,
Um, yeah, and that was when I think back at like what it was, like I could have become a physician, great.
mhm,
But in Jamaica, we have a lot of physicians, great, but the people who are dentists, we don't even have them. They had to be trained in Trinidad to come back to our country. So it's like,
mm,
well, if you could make the biggest impact, which one could you take? I love working with my hands, smiling people,
mhm.
all the things. So it just seemed like the perfect fit, and it has been the perfect fit. So thanks for welcoming me, dentistry.
Indeed. Thanks for following your dreams.
Yeah.
You speaking of following your dreams, you're very well educated and, you've had some wonderful attended some wonderful institutions, but you have a healthcare MBA, which most, dentists do not unless they're in academia. And you also have our corporate, on the business side, but you also have Lean Six Sigma certification. I'm wondering how you employ these additional skills in the office where you practice to make it more efficient, or how do you employ those skills? Because that's a very high level of knowledge, and I'm impressed by it.
Oh, thank you. So healthcare MBA came about from COVID. So I had in the back of my mind a long time ago, maybe. Oh, so I graduated from dental school 10 years ago. I said on my 10-year reunion, I'm going to do my MBA.
Mhm.
Random, right? I'm a nerd. It's okay. COVID
Most
happened.
most dentists are quiet as it's kept, or not so quietly. They may be what people think of us, but you don't seem to be a nerd to me, but I'll take your word for it.
I am. I'm a nerd, but thank you. And yeah, so COVID happened in my organization. I had managerial roles, so I was
Mhm.
managing 8 offices, and that really got my curiosity as to how to make them more efficient. Right, the more efficient you are,
Right.
no overhead, you can maybe hire more people, like all the things that come from being
Mhm.
more efficient. So COVID opened that door. I was like, well, why not now? I was 8 years out. I was like, I'll just do my degree now because everything is shut down. I might as well be in school. But what I loved about my program, I went to Florida International University, super diverse. I've never seen a more diverse program.
Really?
Literally, we had Yeah, diversity upon diversity upon diversity, like literally.
Florida International?
Yep.
I've never even
Florida
heard of
International,
it. Okay.
FIU.
It's a
FIU.
business school?
Yep, it's a business school, and they have a health care MBA program, and it's
Wow.
um, they had I can't remember the credentials that we had, but that a part of it too was just the Lean Six Sigma, just knowing how to make the offices more efficient. So I
Mhm.
figured, given the concerns that we had with long patient time, wait time, high no show rates,
Right, right.
retention and recruitment concerns because of the populations that we serve, where else better to leverage that knowledge
Mhm.
than there? So that was one reason why I chose that program over the others, because
Okay.
it would have given me, or it has given me, that added skill set to be able to incorporate it within my organization. And yeah, we have accomplished some significant goals with that, increased the office by 30% by doing like smart scheduling, tapping into like cell phones, emails, like, triple confirming patients. Some of the things that we did before, but with just more accuracy and analytics that went behind it,
Mhm.
that has enabled us to be successful on the ground as well too. So that was just a little part of it. I know in my corporation they have, analytics for that too, but just being able to contribute, because I had that extra degree behind my name, like it has helped a ton.
Oh, yeah.
My
It will
offices.
it will make a
Yeah.
difference, and a lot of it too is structure and consistency. Sometimes our
Yep.
processes, they just aren't and communication.
Yep.
They aren't given to the team in a way that they can buy in, that they have input on them, and that they really understand what a difference this is going to make. We tend to just have those in manager type meetings, and we're not always talking to the end user, to the right people, and if
Yep.
they understand, you can't always just tell people stuff. That's my big thing. I'm big on efficiency as
Yeah.
well. People need to understand why,
Right. Yep.
how this makes a difference, why my participation is important, and speaking of mindset, once you flip that and take that time up front to do that, oh my God, it's just
Especially.
miraculous. Even in your home, just take a little bit of time to communicate instead of just giving those orders. Oh, I love it. I love it.
Yeah.
I'm not going back to school. I do all my CE and everything else, but kudos to you. I did some other things with that COVID time, but it's nice to advance your skills in different areas and to have options. I know they are happy to have you at your company, that you did that for them voluntarily and have helped them so much. That's the ideal employee right there. Hey, I want to help you guys out. I'm going to go back to school. I
Yeah. Right.
Kudos from your fellow nerd, quiet as it's kept. I think that's pretty good. Here's
Thank you.
another question in regards to your additional advanced learning. I know that you also negotiate employment terms for others or assist them with that. And that's so important, particularly for women, because we've seen so many articles written, so many studies that women don't negotiate. Women in particular just kind of, they're so excited to get the job, they take whatever you give them, but it is critical for your upward mobility career wise and for your family. So I'm just wondering, what is your advice for someone who wants to renegotiate, needs to have a conversation with their manager or employer about their salary? How would you tell them to approach it or to prepare, or just some tips?
Just some tips. I think the number one tip is knowing your worth and knowing that
Yeah.
you are worth it. And we don't hear that enough, right? So
Mhm.
it could just be as simple as practicing to yourself to, slowly remind yourself how much you're worth, right? Because we don't hear it enough. So I know when I
Mhm.
negotiate and I help my employees to negotiate as well too, just going back to what it is that they're accomplishing for their vision. Okay,
Mhm.
so if you wanted a certain increase, and just make sure you're working towards that. You always have to have a strategy behind it. You can't
Yeah.
just go in any day willy-nilly, because they could have like a big budget meeting. It's not worth it to even approach it then. But it's always because you know your worth, you're always bringing value to the table as well too. So just showcasing your value all the time as well too. And then timing as well. So I like to do it at like a 1 year
Mhm.
a 1 year like evaluation, just taking a look at going to Indeed or somewhere else and just seeing what salaries are at that point and just
Right.
seeing where you fall within that. And if you want more, you ask for more, but you got to do it in a way that you're also bringing value. If they know you're valuable,
Mhm.
they're going to give you what you want, but you have to be prepared for the negotiation,
Right.
right? And just being able to go in confidently and ask for what you want is like super, super huge. So it's helpful to remind yourself that you're worth it, and just know too that men, they have no problems tooting their own horn.
None.
None whatsoever. This would be a non-conversation for a guy. Like he's just gonna go
Right.
in, I'm worth, $50,000 more, and he's just gonna tell them, and he's gonna get what he wants. Like it's all in the way that you carry yourself and the
Mhm.
way that you bring value to the table as well too. So really leaning into your worth and just knowing that you're worth
Right,
it.
right. Make
Yeah.
sure they know your worth and you have documentation, to support, your belief that of what you're worth. Like you
Of what you
said,
were
go to Indeed and do the research and salary comparison. Sorry I cut you off, but
There was one more thing I wanted to say too. My
sure,
friend,
sure.
she's been working for a bank for a very long time, and what she does too, she goes on different interviews to
Mhm.
get data as well too. So not just Indeed. We were talking about this the other day. She went on a couple
Right.
interviews just to see what's out there and
Mhm.
knowing what else you could bring to the table, or something that they may be looking for, and
Right.
just using it to pad yourself just so you can keep rising up that ladder. And it's also useful to lean into mentors and the support system that's there as well too. Just letting them know that you want this job. So for me, when I got my promotion as a senior dental director, whatever that title was that I got, the guy, he's like, "What do you want?" I was like, "I want your job." And he's like, "Whoa, yeah, I said I want your job." And he's like, how do I get your job?" And he told me what to do, right? A guy, I just went to him. He's like, "What do you want?" "I want your job." And
Mhm.
he teed it up for me because he knew what I brought to the table. So of course, you got to show them your value. You know
Right,
your value.
right.
You bring the value to the table, and then someone's going to put a good word in for you as well too. It's not always um, that you have to go and apply for a job online. You just got to know the right people as well too.
No, yeah, the collaboration, the
Yep.
networking, you need somebody who will speak well of you when you're not in the
Yep.
room.
Yep.
You need that person in your life, who's championing you.
Yes.
Absolutely, absolutely.
Yeah.
Good tips. Thank you. Thank you
Nope.
so much. As we wrap up here, I wanna just get a little bit more personal. You've mentioned your family, you have 3 boys,
Yes.
and you've said that, you had some challenges, you had to reprioritize and I don't know if it's even changing your priorities, but just your time, how you use your time, because 'cause I'm sure your patients and your family and other things are still important to you, but how you balance your time and your self-care. What advice would you give to people who are juggling multiple tasks like you are, family, work, community?
Always go back to your purpose. So my
Mm,
purpose has always been to serve, right? I serve at home as mom, wife, friend. I
mhm,
serve out in the community, friend, doctor, all the things that I do.
mm,
And um, just taking like a time log. I do a time log each
mhm.
week and just prioritize the things that are important to me, and the things that are not important to me, I outsource.
Yeah,
Like cleaning my floors, they're important. I mean, I can go down with a toothbrush and get it done, but it's like, well, am I going to spend my time cleaning the floor with toothbrush, or
right.
I'm going to read my kid a book for bed and really like
Mhm,
be present with the time that I have with him. And it's also like creating boundaries. So like we mentioned that earlier in
right.
our chat, just
Mhm,
knowing what your boundaries are and being a firm stand for your boundaries, not like, oh, I'm gonna do this today, that today, and people just don't know. They're confused. You got to be set clear boundaries
right.
and honor them. And the biggest boundary that you get to honor is the one with yourself. So
Mhm,
if you say, I'm going to get up and I'm going to work out, you get to keep that, because when you take care of yourself, inevitably that's just going to overflow into other areas of your life. So if you find yourself running out on empty, it's because you haven't really poured into your own cup. Yeah, it really comes back to pouring into your own cup, staying true to your vision, leaning into support, being firm about your boundaries, and really just taking an account of your time in
mhm.
such a way that you know how to like really prioritize them as well too. So those are some of my tips that I have.
Hey, those are great tips, and, I think anyone could utilize those tips and that information to just do a quick reset and a level set. It's just an important part of self-care. Thank you, Dr. Stephanie Stoddart. If there are I think you limit your coaching to, oral health care providers or anyone.
Doctors
Tell us
and dentists, but
Okay.
I'm a life coach. I'm generally trained, but I specialize in doctors and dentists. But anyone who needs help and if I can support, of course.
And
Always.
how would they reach you before we
Through my email, drsteph at stoddartcoaching.com. I'll send that to you later.
And we will definitely drop that in the show notes. It's been a great pleasure, Dr. Stephanie Stoddart. Your patients, your community, all of us are very, very lucky to have you providing healthcare in this country, here and now. Thank you so very much.
You're most welcome. Thank you for having me. It's been a blast.